Actually, mental illness is very common. Just when we look at the rates of depression, the lifetime prevalence of depression is about 20%. So it means at any point in your life, you have 20% chances of developing depression. And immediately here, we see the differences between men and women. So during the reproductive age, any time between adolescence and menopause in women, that rate is 2 or 3 times higher. When we look at the anxiety disorder, this is another major group of mental disorders, and again, women tend to be affected more, with the exception of OCD, obsessive-compulsive disorders, and social phobias. Schizophrenia is much less common, and the prevalence is about 1%. Here, we do not see differences in the rate of schizophrenia between men and women. The suffering, the subjective suffering during depression or anxiety disorders or anything else is actually not different. Men do not suffer less than women, but the two genders are faced with different social pressures and also have different hormonal influences. So, for example, even in today's society, when you're growing up as a male, you're not supposed to express too much emotions. You're not supposed to talk about deep feelings. And some people suggest that perhaps the rate of depression, the differences between men and women are also influenced by that. So men do experience subjectively various symptoms, but are less willing to see a doctor and talk about it. They're supposed to be tough. Now, in terms of hormonal differences, women have more, especially during the reproductive age. There is more circulating estrogen and progesterone, and men have more testosterone. These hormones have been shown to interact and influence emotion processing, cognitive function. So they are these subtle differences, and they also interact differently with pharmacological agents, with drugs. So again, when we treat men and women, we have to look into these factors. So no, the experience, the subjective experience per se, we don't know that it's any difference. Both men and women suffer equally when they're affected by mental illness, but it's just they have to navigate through different social and cultural differences. You know, especially in Canada, with multi-ethnic, multicultural society, often the pressures are very different in different cultural milieu. Because of differences in brain chemistry, in brain physiology, in brain anatomy, these are subtle differences, but they are important when it comes to treatment, especially with pharmacological agents, because they interact differently with this differential chemistry. So this is extremely important to study men and women separately and to verify that the effects will be the same, that there won't be side effects. Many medications that have been on the market, that have been approved, later show they had to be taken off because of significant side effects in women. Also, understanding different pressures that men and women are exposed to is important. When you go and see a doctor, when you go to see a mental health professional, it's important that this person is sensitive to these differences and is able to address them and be sensitive to issue not only of gender, but perhaps different culture. Because again, there are significant differences, and expressing your symptoms, expressing yourself in one culture might be much easier than in another. Expressing yourself as a man might be easier or more difficult than as a woman when it comes to speaking about mental health problems and psychiatric symptoms. So in terms of interventions, when it comes to men and women, we don't see much that is being differentiated. I mean, that's what we're working on. For example, my research has shown some significant differences in brain function in patients with schizophrenia. Now, this appears to be related to the hormonal milieu in a subgroup of patients. So it's not true for all schizophrenia patients, but there's something going on in the subgroup of men and women. How it could be related to treatment is that if estrogen and testosterone play some role in schizophrenia, perhaps modifying the level of these hormones could help. The overall message from my research and research of my colleagues is that there are significant sex and gender differences in mental illness that have to be studied further. These differences include differences in brain function, in brain structure, in brain chemistry, in social pressures, in environmental factors, and we have to take them into account when we study mental illness. Otherwise, our theories are incomplete.